Hello, my name is Kevin Townsend. I am the current Director of Revenue Cycle Management and a Coding and Auditing Specialist for Doctors Management. This brief presentation, Wellness versus Physicals for the Medicare Patient, will cover the current confusion that's been presented since the launch of the new Medicare Annual Wellness Visit versus actual physical exams as expected of by the provider and the Medicare patient. What we'll cover is some background information as well as defining the actual annual wellness visit and the preventive medicine visit as defined in CPT. And we'll also be speaking about different billing considerations that go along with both and options and solutions for providers and their patients. Let's first start with the problem as it's perceived. And it's really a use of the term physical, and that's really what trips most providers and patients up is the terminology, because the traditional expectation for an annual physical is really a complete review of all physical systems with reporting of any issues, complete head-to-toe physical examination, and any needed test to confirm or promote good health or ascertain illness. Now, where the confusion lies is that the patient has a expectation of what an actual physical exam is versus what their Medicare benefits actually cover. And typically that it's very frustrating on the part of both providers and patients, and this can present a surprise, obviously in the exam room as well as at the checkout, and no one really likes that type of surprise. Let's start with an annual wellness visit. According to Medicare, the annual wellness visit is a preventive wellness visit and is not a routine physical checkup that some seniors may get every year or 2 years from their physician or other qualified non-physician practitioner. Medicare does not provide coverage for routine physical examinations. And that's a direct quote from Medicare. They're not expecting that the annual wellness service be that it actually replaces a routine physical exam that would be performed by the physician. However, it clearly states that is not a covered service currently by the Medicare program. The annual wellness visit, as you see, has several components, those being health risk assessment, medical and family history, list of current providers, vital signs including BMI, cognitive impairment screenings, depression screening, safety assessment, establishment of a screening schedule for other preventive services, referrals and for education and counseling services. So if you're familiar with these and have been performing these services, you know that many of them are by a questionnaire type screening mechanisms. If you're not familiar and you're not performing these services, they are Medicare does really want these services performed on their beneficiaries, on their patients, and I've provided a link there to provide a resource page that provides you with all the information needed to begin utilizing these services. What you don't see in these services, other than the vital signs, there's no really mention of any objective type actual examination, a physical examination. And due to the fact that most of the items listed here on wellness do have their questionnaire based, that type of thing, really a lot of subjective information. You know, those are usually gathered by the medical assistants or nurses within the office. And this service really can be done at any other time with other services, as long as all the requirements, you know, for all the services are being met for sure. Now, the preventive medicine visit that we've traditionally known that's been listed in CPT that Medicare, you know, obviously has never covered and they continue not to cover is an age and gender appropriate history and exam, counseling, risk factor reduction intervention, and ordering labs and diagnostics. So oftentimes providers have performed these services. They've had the patient actually pay for that service out of pocket at the time of service, and they've used these codes to report that service. Now, can the annual wellness visit and the preventive medicine visit, can that be performed on the same date or within the same year, and the patient pay for the preventive medicine visit as their physical exam? This is not recommended. Well, it's not recommended using those particular codes, let's say, because there are some of the services listed in the code descriptions that are duplicated between the annual wellness and the preventive medicine, such as past medical and family history, counseling, risk factor reduction. So Medicare could see this as a duplication of services. You're taking money from a patient that basically for a portion that we've already paid for in the annual wellness service. So the actual use of those codes are really not appropriate in that situation. Now, are there other options? And yes, there are. What is recommended is using to report to your patient and to bill is the 99429, which is considered an unlisted preventive medicine visit. So you report this to your patient, collect the fee from the patient, and this code carries no predefined services or requirements, and there's no RVUs attached to this code. Providers, for unlisted codes, providers are instructed by CPT to use these codes in the event they provide a services that are not described by other E&M codes. So this is what is recommended. So in the event that you perform services that are not part of the annual wellness, such as complete review of systems, that head-to-toe exam the patient's looking for, ordering necessary diagnostics, immunizations, etc., then report that with the 99429, as those are not part of the annual wellness service. And obviously collect that from the patient, and you would want to report, obviously what, reporting to Medicare all services you're providing is important. Now, it's not necessary to use an ABN, but it is because annual physicals are statutorily excluded. But it is highly recommended to do so, just because during an audit you can easily demonstrate the patient has been informed that these particular services are not part of the annual wellness, and we are collecting money from the patient. Use a GY modifier when reporting those, not the GA, but a GY, and that way you report to Medicare that you understand it's a statutorily excluded service and that you've collected money from the patient for that service. An example of the ABN that's recommended, make it clear and precise, easy to understand for the patient. You're listing here that you're performing the annual physical exam, and according to Medicare policy, routine annual physicals are not covered. I understand wellness visits are covered, but do not provide for physicals. So that way that it's a clear explanation of why they're having to pay for this service, because it's not part of their annual wellness service. Now, some ask, what about reporting annual wellness in E&M? Some providers report an E&M service to report the actual physical exam portion of that, especially if they have patients with chronic problems. And that's a yes and no answer. Basically, an E&M should only be reported on the same day, only if there's a significant separately reportable problem, such as new problems or an exacerbation of existing problems. Simply listing the status of those chronic problems can be viewed as basically taking medical history, which is included in the annual wellness. So without exacerbation or progression as the medical necessity to perform an examination, the sick E&M may be disallowed. Many payers, Medicare included, consider the absence of actual complaints defined as an actual preventive service. So again, that disallows the E&M with the annual wellness. So again, if the E&M is qualified, and you've identified these separately reportable problems, that they're documented, then apply a 25 modifier to the sick E&M code, and it may be reported with the annual wellness visit. Well, that concludes this brief presentation. Please feel free to contact us should you have any questions or concerns related to this topic. My contact information is listed below on this slide. Thank you so much.